or remote type schedule, so it means a lot for everyone to join and take some time out of their busy day to go over this dashboard with us. A couple of housekeeping items before we begin. This webinar is going to be recorded, and we will distribute the video presentation as well along with the slides to every single user who has joined us this morning. And we will also publish that material to the CRS portal in the next couple weeks. All lines are muted to not give any feedback or have anyone speak out of turn, but we encourage all users and folks joining us to type in their questions into the chat feature located in the bottom toolbar. And we will stop periodically throughout the presentation today to go over and answer your questions. If we don't get to any of your questions today, please still type them in and we will follow up with you right after this webinar. So our agenda for today is I will go over some of the background of the report, kind of a high-level overview of why we developed the dashboard and some of the features of the tool. And then I'll go over how users gain access to this portal. And my teammate, Yelena, will go over the actual features and filters of the dashboard and go over every single tab within the reporting suite. And then my coworker, Anya, will review some of the user stories and ways to think about how to use this dashboard and how it might be applicable to you based on your role in the health community. So the public health dashboard was designed for individuals working on population health and in public health who wanted a deeper understanding of community health. And we're very fortunate in Maryland to have access to a all payers claims database from any hospital setting. And this is because all hospitals in Maryland are required to submit data to the Health Services Cost Review Commission. And as the state HIE CRISP assists with hosting reports and doing some data processing for the HSCRC. And we think this data is really useful, especially at a summary level for users to understand hospital utilization and understand that hospital utilization across different types of metrics. So you could cut it by demographics, conditions, geography within the state. And we developed this dashboard particularly with local health departments in mind. We wanted to give them access to a tool and to this rich all-payer claims database on a more timely manner. So we refresh the data within the report monthly. And we think this tool will be particularly helpful as it shows, as its summary level, it can show some conditions that would otherwise be 42 CFR protected. And this can assist with local health departments focusing on research and developing research to get grants. So I'll briefly cover here the different data sources within the report, but I encourage every user when they get access to this report and they use it for the first time to look at the user guide that we developed, as all of this information is covered in much more detail, and it will assist on understanding where all the data is coming from and how to interpret the data and use it correctly. So as I mentioned in the last slide, the main source of hospital utilization in this report is the HSCRC case mix data. So this is the all-payer claims from the HSCRC for all hospital setting, inpatient, outpatient, emergency department, and observation stays. The data in the report from claims is refreshed monthly, and we have all the data back from 2016 loaded into the report. County and zip code level information come from the HSCRC claims, although the denominators are pulled from the American Community Survey. Conditions within the report are either defined by ICD-9 or 10 codes or the chronic condition warehouse CCW from CMS. PQI's prevention quality indicators. This is a AHRQ methodology, so you'll see that metric displayed in the report, along with readmissions, which comes from the HSCRC's definition from their readmission reduction incentive program. And then all service line information is developed and run through the APR-DRG grouper or APRG grouper, depending on the data type. So the next logical question to ask when you understand some of the background of this report is, how, as a user, do I get access to this report? So for hospitals, all of the points of contact at the hospital for CRS will have access to a credentialing application, and they can add the non-PHI Tableau reporting role within that application to every user's account, and then this public health dashboard will be populated on their CRS portal. The CRS team is working closely with the Maryland Department of Health to establish points of contact at every single local health department. And in the next couple months, we believe that all of the local health departments will have a point of contact, and they will have access to the same credentialing tool as well. If you're not sure who the point of contact is for your organization, please email support@crisphealth.org, and we'll be able to direct you to the correct person or assist you to get access to this dashboard if we cannot find your point of contact. We ask all users who get access to this report to either have signed an end user agreement in the past or signed a new one when they get access. On the next screen, it'll show you what that looks like, and you can simply have your point of contact or the user directly email it to our support line or one of our team members, Grace Kading. And we will save this documentation and make sure that your access has been granted appropriately. This form just covers the rules with accessing the data, and as well as some security requirements for using the data appropriately. Once a user account is set up, and if you didn't have access to the CRS portal in the past, you will receive an email from CRISP Log1 Support with an activation link. And once you set up your account, you'll be able to access the CRS portal. And that home page for the CRS portal and the login screen looks something like this. You can see the URLs listed on the top, reports@crisphealth.org. The CRS portal is where we host all of our reports. So once you log in, your screen may look like this or may look a little bit different. You might have more reporting blue cards listed at the bottom there. So I recommend all users use that wrench and spanner icon to organize the different report cards on your dashboard, to be able to find the public health dashboard more quickly. Also with this tool, you're able to hide or unhide reports that you have access to. Right next to that, you'll notice some page filters where you're actually able to move back and forth between the different pages if you have access to many reports. So I will stop briefly and answer any questions regarding the background of this report and how users get access. And I'm going to turn it over to my teammate Grace to see if there's any questions that we'll answer, and if not, we'll get moving with the rest of the presentation.
Thank you, Kevin. I don't see any questions at this time, but we can wait a minute. All right, so the first question that came in, will CTOs in MDPCP be able to gain access?
Yes, so if any MDPCP user emails support, we'll be able to set them up with access. We're working with the PMO office to see if this is something that we would want points of contact at MDPCP to be able to grant access to. But for the meantime, the CRS team will credential any MDPCP user as they request.
And then the next question, I'm the POC for our organization, but don't see the HOSP ID report listed as one I can assign access to.
Feel free to reach out to the support line after this session, and our team will be able to do some more individualized troubleshooting with you. When you first get into the credentialing application and you click onto a user, there's a different types of report types that are listed there, and you have to click over to the case mix specific reports. So it might just be that when you look at it, it's not appearing right away, but with some more individualized support, we'll probably be able to help you better utilize the credentialing application.
And maybe, Kevin, just one thing to add to that is if you're a hospital user, it comes up under the Tableau summary report. There's not a separate breakout for the public health dashboard.
And then the next question, the public health dashboard does not appear in the list of cards. How do we get access?
I would start with emailing support@crisphealth.org, and then our staff will be able to direct you to the correct point of contact, or one of our team members will be able to set you up with access.
And I don't see any other questions at this time.
Awesome. So feel free to continue using that chat feature throughout this presentation. But with that, I'm going to turn it over to Anya to give a little bit of more background and ways to think about how to use this dashboard.
Great. So before we jump into the details of the dashboard, just wanted to take a minute to step back and maybe frame one way that you all could use the dashboard. On the call today, we have individuals from the local and state health departments, hospitals, community-based organizations, and I think one of the strengths of this dashboard is that all of you all can have access to a shared report and a shared data source. And so one example that we thought we could use to kind of guide going through some of the features of the report today is looking at diabetes. Statewide, diabetes is a priority that many of you all may be working on. And so this dashboard has some different measures to help you look at the diabetic population, either statewide or in specific zip codes of interest, and compare that to the state, whether it's looking at hospitalizations, potentially community preventable diabetes hospital visits, and I think this dashboard could be used to kind of promote shared measurement between local health departments and hospitals. So with that, I will turn it over to Yelena to talk a bit more about the dashboard.
Thank you. And again, we will be pausing every few slides during this presentation to take your questions. So if you have a question about a slide, please do feel free to enter it and we'll pause to address them. Okay, so these are some of the Tableau report features you already might be familiar with if you use some of the other reports, but if not, we will go through them. So across the top here, you have some navigation buttons on the left-hand side. And the most important one to use is probably the pause button. This is very useful if you're selecting a lot of different filters that we'll go over in a minute. But this is going to pause the refresh of the report. So you can go in, kind of make all the selections that you want with the pause button selected. And then once you're ready, you can click the pause button again and the report will refresh with all the filters that you're interested in. You also have the revert button. This will restore the page to its default view. So essentially remove kind of any filters or any changes that you've made. Then you have refresh, which will refresh the data for kind of more complex queries that you're doing. Then on the right-hand side, you have your help, print, and Excel button. The help will show you the location of the user guide. The print is essentially print to PDF. And then Excel will download parts of the report that are available for download in Excel format. So these will be some of the mostly tables that are presented in the report that you can then pull into an Excel data set and potentially do some of your own analytics on. Okay. So the report, as you can see, has very many filters. It's very customizable, so you can view the population that you're interested in. It starts with the utilization filters, so you can look at your data by the different visits, dates, conditions, as well as hospital name, and then the kind of visit type, payer or high need population, and prevention quality indicators, and the service line. You also have demographics, as well as other filters. So this allows you to drill down to your population of interest. For example, if you're interested with people who have diabetes, you can select that either in the chronic condition filter, and the report will just filter down to the diabetes population. You can also filter for visits, diabetes visits that could have been potentially prevented using the prevention quality indicator feature. Okay, so this goes into more detail of some of the filters. As you can see, for the visits that are included in this report, you have choices of your inpatient, emergency department, and observations, both greater and less than 24 hours, presented separately. And then here a list of all the conditions. Again, some of these are defined by the chronic condition warehouse, and some of these are based on the ICD-9 and 10 definitions. And all of those are also presented in the user guide. So you will be able to see kind of how each one is defined and what condition, what ICD-9 or 10 codes are. Okay. The service line indicator is another way to filter the data. So you can select a particular kind of service that the patient received during their visit. And then the prevention quality indicators will kind of show you the potentially avoidable admissions, either for diabetes, like we mentioned, or some of these other areas, such as COPD, asthma, and hypertension. Okay. We're also providing filters for demographics. This includes age group, race. Again, here you can see how it's broken out. Ethnicity of Hispanic or non-Hispanic, gender. And then the geography filters include zip code and county. Okay, so this is the first tab of the report that will appear as you access the report. And this is presenting kind of the overall view of the hospital visits in Maryland. And it's broken out into 6 different panels, showing you the race, gender, and the payer, and then breaking it out by condition, age group, and hospital. At the bottom right-hand corner, you also have your date available indicator. This will refresh on a monthly basis, and it shows you how recent the data is. Hospital utilization, again, displaying it for the payer, conditions, and hospital. On the next slide, we'll see how to navigate this report. So here it's showing before on the left-hand side and after you selected a corner of the pie chart. All of these pie charts and bar charts are clickable. So once you select either one pie or one bar, the whole report will update just to show the data for that selected either pie or bar chart. So in this case, only Medicare fee-for-service payer type is selected. And you can see that the race and gender have changed, kind of the pie charts have changed to reflect that it's just Medicare fee-for-service, as well as the age group, hospital, and conditions are updated. You can also select multiple pie or bars at the same time to really filter more into the data. So for example, if you're interested in Medicare fee-for-service, diabetes population, you would first select kind of this payer pie for Medicare fee-for-service, and then you can also select the diabetes condition bar, and the whole report would update. This is kind of an easy and fast way to click through a number of different options and see what the population, how the population is changing. Okay. And we'll pause here and address questions. I see some questions have already been entered. So the first one is, when will the slides and recording be available for this webinar? Where can they be retrieved once available?
Thanks, Yelena. I can answer that one. So we'll actually send out the recording and the slides directly to every single participant of the webinar today, but we'll also have these slides and webinar recording directly available when you access the public health dashboard. So if you have access to the report and you click in to launch the Tableau icon, you'll notice a kind of a documentation icon and a video icon right next to that, and that's where we will host these 2 materials.
The next question is, are the chronic conditions in any position or a primary diagnosis for the patient? The chronic conditions are any condition, so it can be primary or any of the secondary conditions appearing on the claim that are currently flagged. And again, the kind of the documentation for this report does go into a lot of detail for each single chronic condition. So if you're interested in a particular one, such as diabetes, you can kind of drill down more into what it means using the guide. Next question is the data tailored to the practice or is it statewide data? This is statewide data for all Maryland hospitals. So the filtering capabilities that's presented here in the report is kind of allowing you to then tailor it to your needs. But it is summer level statewide data.
Yeah, and I'll piggyback on that, Yelena, and just mention what Anya mentioned in the past, that we designed this dashboard to be accessible and usable for many different types of users. So with that, we designed it to be kind of the whole aggregated state information, and then you could drill down into the different population that you wanted by using the variety of filters and selectors that we have available.
Okay, if there are no more questions at this time, we can continue. And again, we'll keep pausing and taking your questions. So please bring them as they arise. Okay, the next tab of the report is the population compare. This is kind of a little more detailed drill down, and it's set up to allow you to maybe compare two different factors between two populations. The left-hand side will be your primary population. So the filters you select on the left-hand panel will propagate through the rest of the report. And then the right-hand side is kind of your comparison population. Again, you can see you have all the same filters presented here. And it's so that it's a very flexible way of comparing these two populations. For example, you might want to compare 1 year to another, or potentially two different chronic conditions. If you're still looking at diabetes, you could select diabetes in both panels and maybe compare the numbers between two different hospitals, or potentially different age groups. Kind of, you can select different demographic filters. As you're starting with this feature, we probably recommend only changing, 1 or 2 filters at a time so that you can kind of see how those comparisons are affecting the numbers one by one. If you are changing multiple filters and utilization metrics simultaneously, it might kind of mask what is having the biggest effect on your comparison in primary population. This is also where the Excel download tab may be very useful, because then you can do additional maybe calculations or data manipulations in Excel between these two populations. And you can actually maybe calculate a difference or percentage difference between the different values. And these are all the metrics that you have throughout the report. So these were the metrics that you have for the population comparison, but then you will also be able to use these metrics throughout the rest of the report. I won't go into detail for each one, but just as a summary, you kind of have your total count of visits and patients, and then you have them normalized by the population. So visits per 100,000, and this works at a selected geography level. So by default, it's going to be statewide. It's going to be divided by the population of Maryland. If you select a specific county or zip code, then it will be the population for that county or only. Then next you have rates, so readmission rate and the prevention quality indicators rates. Also length of stay, as well as the average length of stay per visit. And then you have your charges, so total charges, and then again charges normalized by the population, as well as average charges per patient and per visit. This tab is very similar to the population comparison. However, instead of just showing the total metrics, it's also going to break it out by service line that's on the visit. So you'll be able to compare how the service line numbers change from one population. On this chart, you can see the trending of your primary population. Again, the filters that you have already selected will apply on this tab as you move here from the population comparison. And now you can see how some of those metrics change over time. At the top here in blue, you have your category selection. This is going to change how what field is presented in the colors of the lines. So currently age is selected and it's showing the trend by the different age groups. And then the field highlighted in red are all the different measures that we covered in the last slide. So this is currently selected to visits, but again, you can select it, visits normalized by the population, average length of stay. So you have all those choices that you can, again, trend over time. Then there's also a plus or minus sign at the kind of middle bottom right of each chart. This will change the axis. Right now the axis is set to quarters of each year. If you hit the minus sign, it will zoom you out, so you will have years, so you can view the data annually. And then hitting the plus sign will kind of zoom in to more detailed, and you can see the data on a monthly basis. The chart below will show you the charges per capita. The orange line will be the statewide average, and then the blue will be the selected geography. So this is kind of a way to compare a geography to state. And again, this can be either at the county level or zip level. Okay, this is showing you the options that you have for the category and the measure selections. So for category, you have your two geographies, as well as you can view it by hospital, payer, age group, gender, and race. If you select a category that has a lot of values, such as hospital and payer, again, it will only show the top 5. If you want to select different ones, you can use the filters on the right-hand side to select, for example, the 5 hospitals that you are interested in seeing. And again, this is in the measure section is all the measures that you can view by. So visits is presented right now, but you can change it to just per capita or readmission rate or any of the other measures. So the utilization map is going to show you the data map either by county or by zip code. And under the geography drop down, you currently county is selected, but you can change it to zip code. And the table below will contain the data that's presented on the map. On the map, you have the same measure selection, so you can either view it visits or any of the other measures. And the important thing here is, again, you can export this data into Excel if you want to manipulate it on your own or perform additional calculations on it. and it will export either at the county or the zip code level. And let's pause again for questions.
Perfect. We received one question. So, can regional partnerships compare by using a RP specific panel versus only attributed patients by geography?
I can take that one. So because this is a summary level report, we are not enabling any patient-specific uploads. So you're not able to compare a regional partnership-specific panel, but you can look at the zip codes of interest that your regional partnership is targeting.
And I don't see any other questions at this time.
Thank you, Grace. Great. We can continue on to the next slide. And again, please, enter questions as they come up. So the excess map is going to be similar to the utilization. And again, you can see it by county or by zip code. The difference here is that each geographic region will be compared to the state average. So this is a little more complicated than the utilization map, but you can think of it as kind of areas being either above or below the state average, normalized by their population. And once you're in the report, actually, when you hover over the map, you will be able to see the formulas that are used for each calculation. However, do keep in mind that this is not case mix adjusted. So if you're kind of drawing any conclusions from this map, that may kind of affect what conclusions you can make. This is kind of raw averages of the county compared to the raw average of the state. You also have the same table below the map that you can download into Excel. And that may also kind of help you see how the numbers are calculated. It shows you the observed, the expected value, and then the excess that is graphed on the map. So the visits here are slightly different. The measures here are slightly different from the utilization map. But again, you have your visits or your visits per 1,000 population, the readmission rate, the potential, the PQI rate, or the average length of stay per visit. And again, we'll take questions. So the question that came up again is there a future opportunity of risk adjusting the excess map? Anya, do you want to address that?
Sorry, I was having trouble unmuting myself. Yeah, I think that is something that we can look into as a future enhancement for this dashboard. I think we would need to think about the methodology a bit more, which is why it was not in the first iteration of this report.
Okay, and then the next question is the expected calculated based on the current year or some previous year time period. And if we go back to the excess map, so no, it is not based on a time period comparison. It is just based on a geography to statewide. So each of the counties in this case is being compared to the statewide average for the time period that's selected. So you can do some kind of time comparisons here by changing the date filter, but just keep in mind that when you're changing the date filter, it is still comparing it to the state. So for example, if you select just calendar year 18, it will be comparing the data for that year statewide to each of the counties. And the orange will be higher than the state average, and then the blue is lower. Are there any other questions on either the maps or report navigation or any of the slides that we've covered? We're happy to go back and focus on some of the other tabs or slides if they're more useful to. Do you know if sepsis will be added in the future? That is definitely something we can consider. I do know if that's something we already have in kind of a future utilization. Yeah, I don't know if it's currently available, but
yeah,
we are.
I'm checking to see if it's currently available, but I think that seems like something that we should be able to add.
Yeah.
Okay, I see your, yeah. Then we can look into that as adding that as a future enhancement to the dashboard.
So it looks like another question came in. Would you please go back and show me what to click on to get to the slides that you have showed in this presentation? I do not seem to have the same access to the data that is being presented, and I'm the POC for my organization.
So I think this user is mentioning how to get into the dashboard at the very beginning. So like I mentioned, there's this wrench and spanner icon, and if you have access to many reports, you might have to either change the page or do some filtering on that icon to get to the correct card. But the report looks like this, public health dashboard. And when you click into that, you'll be able to launch the application. If you're having individual difficulties finding it, please reach out to our support line and we can assist on a more one-on-one basis.
Okay, another comment came in. I'm having the same issue as well. I clicked on the wrench and spanner and I am still not seeing the report. I sent email to CRISP.
Yeah, we'll be able to solve any user-specific issues if you send it to the support line. So thanks for your patience.
All right, I don't see any other questions at this time.
Okay, great. So I think we have 15 minutes left. So if people have questions, feel free to continue to add them to the chat box. And then I think in the remaining 15 minutes, we could maybe just talk through some different use cases of how people could use this report, since there's a lot of information, a lot of filters, and it may seem a little overwhelming. So I think the first kind of user story we walked through a little bit at the beginning in terms of having a shared data platform across community-based organizations, local health departments, and hospitals. I think for hospitals, one use of this report that could be particularly helpful is for the Community Benefits Office, and wanting to understand community needs and understanding for my kind of given set of zip codes, my primary service area, what are the top conditions impacting this area, assessing the prevention quality indicators, which could be can be indicative of community access to care and essentially individuals having inpatient hospitalizations for conditions that could have been prevented in a lower acuity care setting. For local health departments, I think in addition to monitoring conditions of interest, this information could be really helpful for grant application process. And understanding, so for example, for substance use disorder, being able to look at the number of ED visits for substance use disorder in your county, and then also look at the costs associated with those ED visits, and look if you're able to kind of reduce costs over time through your different interventions. And also looking at, for your given jurisdiction, maybe for substance use disorder, what hospitals are patients going to and with whom should you be partnering to work on implementing interventions. And then finally, for community-based organizations, one example could be a community-based organization wanting to partner with a hospital to reduce pediatric asthma visits. So similarly, you could look at kind of top hospitals to partner with, look at the total number of cases or hospital visits in your target area. So those are kind of some specific examples. If it would be helpful, we could try, I think we could do kind of a live demo of how you could apply some of those filters and drill down through the dashboards. If there's no further questions that users have at this point.
There haven't been any questions that came in.
Okay. Okay, great. So I can share my screen. Can you all see my screen?
Yep.
Okay, great. Let me just zoom out a little bit. So if we were going through a use case of a local health department, let's say wanting to look at substance use disorder, then they could look, let's say, for example, they want to look this calendar year, what has been happening, or in the previous calendar year in 2019, what was happening in their jurisdiction. You want to put the pause button since we'll be changing some different types of filters. And looking at ED visits associated with substance use disorder. Uh-oh, this is hiding. There we go. Any substance use disorder. And we'll leave it at that. So now you can see we're looking at, for calendar year 2019, what are the hospitals that had, oh no, okay, it did apply. There we go, okay, just want to make sure that went through. What are the top hospitals statewide that had visits of patients who had any substance use disorder? What's the primary payers? So you can see that almost 50% of patients statewide had Medicaid who had those visits. You're able to see the race and gender breakdown, and then also understand a little bit the age groups with hospitalizations for substance use disorder. So then we could go to the utilization map, for example. Hopefully it won't take too long to load. There we go. And we can adjust at, let's say, visits per thousand. And then you could see kind of how your county potentially compares in the number of ED visits for substance use disorder per thousand residents relative to other counties in the state. So if I was working for the Dorchester County Health Department, then I could click on that county and I would be able to see the number of visits, patients, the total charges, and then the population in my county associated with substance use disorder. And then you could also switch to the zip code view to see if there are kind of zip code hotspots where there's high ED visits for substance use disorder among your residents. And then all of those data points are Excel exportable if you use GIS or other mapping features and would want to be able to join this data with other data sets. So then you can look and see kind of for your zip codes of interest, what are the total number of visits in calendar year 2019, the total number of patients and charges. So that is kind of one way in which you can use this dashboard to drill down into a condition of interest. And then if we go over to the trend view, for example, you could look at the trends for visits kind of over time to see if they're going up or going down. So you can see in terms of the top payers, or if you want to look at which kind of zip codes or hospitals have the most burden of ED visits per thousand, then you could look at the top 5 zip codes that have the highest visit per thousand rate for substance use disorder.
Anya, one question we got regarding kind of the maps and the geography in these reports, are they based off of the patient's home address or the hospital that they receive the care?
Yes, so the geography is based off of the patient's home address as recorded in the case mix data at the time of the visit, the zip code where they reside. And then there is a filter on the right by hospital. So if you were interested in a more hospital-centric view as opposed to necessarily like a county health department view, you could filter on your hospital of interest and then look at the zip codes where the patients reside that are coming to your hospital.
Awesome. So yeah, I think this gives a good example of how flexible this tool can be and why we've kind of opened up the access for so many different groups of users, because you could utilize it in many different ways. The other thing I'll just point out before we move off of the demo, Anya, is when you change tabs, you noticed that all of the filters stayed the same and they're kind of sticky. So it's really designed in that first tab, the summary tab, to kind of pick your population of interest and then utilize these different tabs to really drill down and do some analysis on that said population.
Yeah. So I think I can pause with that. Oh, I see there's another question. Is there another question?
Yeah, we got another question about what type of users can access this. And so any typical user who would use course reporting services, so hospitals, ambulatory providers, local health departments, community-based organizations, all of them are available to access this dashboard. So we have 5 minutes left, so we can stay in the line and answer any other questions. The last thing I'll note is we have another webinar available Thursday, March 26th at 2 p.m. It's going to cover the same material, so if you came today, there's no need to join again unless you want to ask some more specific questions. But if you think of any team members or anybody in your organization who would benefit from some more training on this dashboard, feel free to send them the registration link and we'll keep highlighting it in our regular CRS user communications. As we mentioned throughout the webinar, please use the support@cresthealth.org email inbox to ask questions, comments, or give feedback about the reports. And we will be contacting every individual who's joined the presentation today with the slide deck as well as the recording of the webinar. And we want to thank you again for joining us. It really means a lot to us and our team. This was a lot of work, but we really think this will be a helpful window into the all payer case mix data.
So one comment and came in. This is spectacular for total population study and determining target populations. Once we do that and apply an intervention, we need to compare the ones we have assisted to those we have not. Thus, the request for future panel loading while keeping at summary level. Maybe you could consider that in the future.
Yeah, great. That's definitely something that we can add to our backlog.
Yeah, and we also think that this report can be used in this way to kind of do what you said, look at the target populations, and then maybe leverage some of the other tools we have available in CRS to do some of that more drilled down analysis. But it's something, like Anya mentioned, that we'll keep in our backlog for future iterations of this particular dashboard. All right, well, thank you all for joining us. We will be in contact shortly with the training materials, and we hope you have a wonderful and safe day and rest of your week.
Thank you everyone for joining.